Okay. Thanks everyone for joining today. I really appreciate it. My name's Kavi Devulapalli. I'm an interventional radiologist. I am the founder of Image Guided Solutions Missouri, and I want to talk to you about vein disease. And we're going to talk about feeling confident and feeling better when it comes to your legs. Again, my name's Kavi Devulapalli. Really appreciate you guys joining us today. A little bit of background about myself. I'm an interventional radiologist, so I know a lot of you invited to this webinar may have been LinkedIn from Columbia Orthopaedic Group. One of the physicians that's part of the group. I run an affiliated practice. Relatively new to Missouri, as you can tell. I've trained in a variety of places, coast to coast. I grew up in Ohio. I've been in Missouri for a couple of years, and proud to be a part of the community and hopefully offer what's been a valuable service, and hopefully could help out some of you all listening today. I wanted to give you guys a little bit of background about myself and our team. What I do is great, but I'm nothing without the wonderful folks who work with me. We have a great team here. I have a technologist, KC, April Ryan's my medical assistant, both of whom are pictured with me here next to some of our imaging equipment. We have a wonderful vascular sonographer as well, Kelly Dill. Great staff. We have a great nurse, Ashley, scheduler, Kelsey, and we're really happy to be offering this service. We're affiliated with the Columbia Orthopaedic Group, and our clinic is actually shared with Columbia Podiatry. So for those of you who may have had any foot care with Dr. Foster over the years, or more recently with Dr. Dow, we share offices, and that's actually where we do a lot of our vein treatments that we'll talk about. So really getting into the meat of this, I want to talk to you all about vein disease. I want to go over what it is. I want to go over why detection and treatment matter, and specifically how our practice can help you. So to start off this discussion, I think it's very important to take a step back and just think about our blood vessels in general. And there are two types of blood vessels in our bodies. There's arteries and there's veins. And what I tell every patient is arteries are kind of like the water lines that run to our house. Arteries are very important. Like if you don't have water coming to your house, it's hard to live. Likewise, if you have a blocked artery, that could be a medical emergency. So if you have a blocked artery to your heart, that's a heart attack. If you have one to your brain, that could result in a stroke. Veins, on the other hand, are a little different. Veins are kind of like the sewer lines in our body. And, veins have a hard job because they have to travel uphill in our legs to get that blood back to the heart. Um, Veins are often under-recognized because a lot of times there aren't many medical emergencies associated with veins other than blood clots in the veins, which are relatively rare compared to other issues that can happen with the veins that affect many patients. And we'll talk about some of that. But we're really focused on the veins here. So that's the important thing. And when it comes to veins, there are two types of veins. There's deep veins that are really underneath our skin and really in the muscle. I tell everybody that the deep veins are kind of like the interstates of our legs. They're responsible for about 90% of the blood flow getting back up to your heart from your legs. So there's a lot of blood cells going through here all the time. They're very important. As I mentioned before, it is possible to get blood clots in these veins, and that can be a life-threatening situation, but they're relatively rare compared to the issues that can happen with the superficial veins. Those are the veins that are a little closer to the skin surface. A little bit of a misnomer because superficial doesn't necessarily imply that you could always see them. So there's several superficial veins in our legs, and oftentimes these veins are actually 2 to 3 centimeters beneath the skin surface. So all the veins that you may see on your legs or family members or friends, those are actually tips of the iceberg, if you will. Those are generally veins that are affected due to these underlying superficial veins. So it's what you see, but really the problem is a little deeper, and I'll go through that here in a little bit. So when it comes to veins, they have a hard job, as I mentioned. They have to go uphill against gravity, and they have to bring blood back to our heart. And the way they do that is there are these little mechanisms inside of the veins. They're valves. And every 2 to 3 centimeters along a vein are these tiny little valves. And what happens is when the muscles squeeze, these valves pop open. That helps propel blood back up to the heart. When the muscles relax, these valves close. And that keeps gravity from taking that blood and bringing it back down. So that's how veins should function. And when we have healthy valves, we have healthy veins, and we generally do great. The problem is with vein disease, it's the process where these valves are no longer healthy, they're diseased. And what I mean by that is these valves don't close. So what happens is the valves spread apart, and when the muscles around our veins try to contract and squeeze, those valves could no longer close, basically. So gravity acts unopposed. That pulls blood back down towards our feet and our ankles, and that can cause a variety of symptoms that we'll go through here in a second. But when we think about vein disease in general, and we think about how common it is, actually one of the most common medical conditions. In fact, upwards of half of all Americans, half of all people around the world have vein disease. It is more common than cancer and strokes and peripheral arterial disease and diabetes combined. And the crazy thing about it is a lot of us don't even know we have it. We kind of live with it for many years. We get used to it. And we oftentimes attribute it to something like getting older or just old age. But this is a progressive disease, and without treatment, things could get worse potentially. There's many risk factors for vein disease. I'd say the biggest one is age. So the longer we live, the more likely we are to have veins that don't function properly. Genetics is very important. These oftentimes run in families. We see this every day. We have patients who have family members, mothers, sons, daughters, etc., who have vein issues. Blood clots are also certainly an issue for those patients who do have deep vein disease. They're likely to have problems with their valves, and that can cause issues. But other factors as well. It's definitely more common in women than it is in men, though it is still very common in men. But factors like pregnancy can definitely impact vein health. So it's not unusual for women after especially multiple pregnancies to notice symptoms of vein disease. If you're on your feet for a long time, so we have many patients, especially medical professionals, doctors, nurses, etc., people who are on their feet a long time. And then also obesity is very much a risk factor because having a lot of weight in the center of your body makes it hard for blood to get back up to your heart. So certainly relieving some of that pressure and healthy eating and weight loss is very critical to supporting good vein health. So what are we actually looking for? And what I want you all to kind of keep in mind, how does this affect the patient? Well, vein disease symptoms are relatively common, and there's a variety of different symptoms. And these symptoms don't necessarily always run together. It's possible that you may only have a handful or maybe even a single one of these symptoms, and you can still have vein disease. But the common things that we look out for first is one, how things look. So varicose veins or spider veins are common signs that we see. Varicose veins being those ropier veins that you can see on that patient's right leg. The spider veins being the veins that are a little bit closer to the skin. Again, these are all tips of the iceberg. There's underlying issues in the veins deeper and beneath the skin that are causing this. Leg heaviness, leg aching, tightness, fatigue, just that tired, heavy leg sensation, especially when you've been on your feet for a long period of time. That's vein disease. You can often tell if you go home and you got to kick your feet up on the couch or the bed to feel better, you probably have vein disease. It can cause pain. Pain is very common. The veins can get inflamed. You can have pain along where the veins are. And you may not even be able to see veins, but you could have veins underneath your skin that are causing you to have pain. So certainly that's a symptom. Swelling. Swelling's a big one. Restless legs. Actually, the number one reason for restless legs is vein disease. A lot of people don't know that. Things like numbness and itching, that's possible. You can have skin changes. And then in its worst state, you can have skin breakdown or ulcers and wounds that could be a result of vein disease. For those of you who've maybe have had orthopedic surgeries before, knee surgeries, hip surgeries, foot and ankle surgeries, it's often the case that patients have leg swelling after these procedures. And in many of those situations, patients actually have underlying vein disease. So it's very common. And then, of course, we see a variety of other symptoms within the orthopedic population, varicose veins in general, ulcers, neuropathy, pins and needle sensation, numbness, tingling, especially on the underside of the foot. That can definitely be a sign of vein disease. Restless legs, as I mentioned, and cramping as well, common symptom. So detection of vein disease matters, especially for those of you who may be listening to this thinking about maybe getting a knee replacement or a hip replacement. If we're able to identify and treat vein disease before a major orthopedic surgery, we could actually decrease the risk of having a blood clot. We can make recovery after the surgery a lot better, a lot faster, a lot safer. So there's a lot of complementary things that we can offer. that can help kind of get through major surgeries. So this is definitely something to consider. Now, how can we actually help with vein disease? Well, we really help in three ways. First thing we can do is we can diagnose it. We'll talk a little bit about that. There's things we can do to treat it, which is, I'm sure, what many of you are interested in. And then, of course, we provide management and longitudinal care because this isn't as simple as being a one and done thing. And I'll explain that here in a little bit. So the diagnosis is really threefold. We see every patient here in our office. Our initial examinations are usually around 30 to 45 minutes. Every patient sees me. We talk with you about your history and kind of your story, what you've been through, what your symptoms are. I'm often able to tell the moment I walk in a room what's going on just from looking at you. We take a look at your legs, we feel your pulses, we check for swelling, we measure your ankles and your calves. The physical exam plays an important role. And then finally, an ultrasound. And what's nice about what we offer in our practice is many times we're able to do the ultrasound the same day. So it's an added convenience to help you get in and out faster. The clinical history, again, we're looking for these common symptoms we mentioned: tired and heavy legs, leg swelling, restlessness, cramping, or if you have any wounds, especially on the shin and calf, those are symptoms and presentations of vein disease. We use a classification system to describe vein disease, and I don't want to belabor you with all the heavy medical details, but the idea is we're able to actually see how vein disease progresses. And really, it's this picture that's most relevant, because some of you watching this may be able to look at this and actually see if your legs might match one of these. So what happens is vein disease typically starts as spider and reticular veins. That's that picture labeled C1. It can progress. You can start getting these ropier veins. You can get swelling. You can start getting skin changes, especially in the summertime now. When you go out, you see people with shorts. You can see redness around the shins and the calves. Those are signs of vein disease. What happens is the blood is so congested that you can actually get staining from the pressure of the veins itself. And, oftentimes patients ask me, can that redness get better? And unfortunately, not. We can get it a little better, but usually once you have that staining, it's pretty much yours to keep. So this is a sign of pretty severe vein disease. What treatments can do for severe vein disease is they can help swelling, they can help pain, and they can prevent you from getting to this state. So these are ulcers, basically. C5 is a healed ulcer, and C6 is an active ulcer. That's to say that the pressure in the skin gets so high that the skin could pretty much pop open and you can get these wounds. So those are pretty severe stages of vein disease. The important thing to keep in mind is not everyone progresses in a linear fashion. It's possible that you can have C1 disease and then maybe not end up with these ropier veins, but you could end up with swelling. And that's a pretty common progression pattern. So not everyone moves in linear fashion. So everyone's a little different. Venous anatomy, there's several main veins in the legs that we're looking at. The two big ones we're concerned with is a vein that runs on the inside of the leg. We don't need to worry about all the medical terminology, but the big thing is if you ever notice any problems with veins on the inside of your leg, it's probably vein disease. Additionally, there's a vein in the calf. If you notice any issues with the veins in your calf, that can also be a sign of vein disease. So those are common veins that we look at. And the reason that matters is because those are the veins that we are studying when we do an ultrasound. So the idea with an ultrasound is we're not only looking for blood clots, which I say are relatively rare compared to having what's called superficial vein disease, what we've been talking about, but we're also looking at the superficial veins itself. And specifically, the way we do this is we typically stand patients up and our sonographer will put an ultrasound probe on the veins of interest, typically on the inside of the thigh and the calf, and as well on the back of the calf. And what we're able to do is we're able to measure the amount of time that blood is flowing in the correct direction. So in this image here, anything above the baseline is blood flowing the correct way. And if there's ever any signal that's below the baseline, that's referring to blood going backwards. So that's what's going on here. And we're able to measure that amount of time blood's going backwards. And that gives us an idea of how bad one's vein disease is. We're able to diagnose it medically that way. So a couple notes before we get into some of the treatments. So the first thing, and I don't say this to be discouraging because there's a lot we can do, but there isn't any real cure for vein disease. We can't make it disappear for good. And the reason I say that is because having vein disease is kind of like having high blood pressure. It's kind of like having diabetes in the sense that, we can never truly make it disappear, But what we can do is we can make symptoms a lot better, and we can make the legs look a lot better too. So we can manage it. And we have some pretty cool tricks that we can do to help out. We can definitely improve symptoms. We can make your legs look better, and we can make them feel better. But the important thing is it's not a one and done thing. It definitely requires multiple visits, and our patients get to know us very well. And I tell everybody it's not all that different than going to the dentist. I wish you can just go once and get your teeth cleaned and never go back again, but it's generally good to go every year. And that's not to say that everybody needs a vein procedure every year, but we do like to check in with our patients at least once a year to see how things are going. Usually at some point, vein disease will rear its ugly head again. And I usually tell most folks it's generally at least several years after we do initial treatments, but it's still good to kind of get checked out. So the treatment is relatively straightforward, and I'd say there's two buckets of treatments, if you will. There's non-interventional treatment, that's compression, and then there's actual minimally invasive procedures that we can do here in our office, and I'll go through those. So compression is the first line treatment. I'm sure some of you have heard about compression socks or maybe are even wearing them. But the idea of compression is you can imagine, as we discussed earlier, if you have veins that are not closing properly, by actually applying an external force on those veins, we can cause those valves to close. We can help get the blood back out, and we can keep the blood from falling back down towards your feet and your ankles. So compression is very important because it's physically helping to get that blood out of your legs. Now, compression is oftentimes very challenging for patients, especially if you have really swollen legs, or if you have arthritis in the hands, or if you have back problems and you have trouble putting on these really tight socks. We have other solutions. So we oftentimes prescribe compression wraps. These are Velcro wraps that you can put on from your calf to your ankle. Compression is always tighter at the ankle than it is at the calf, and that's to create a gradient to help promote blood to get back up towards the heart. So these are a great solution, and we fit patients for these devices, either compression socks or wraps in our office, and we do that almost every day. So we're happy to help with that. There's always going to be some good solution for compression. So if you have not found that solution yet, it's certainly worth a visit with us. Now, after a patient tries compression for a period of time, generally 6 to 12 weeks, at that point, we see how they do with their compression. And if overall things have been going well, but they feel like maybe there's still some symptoms that could be even better, which is often the case, we're able to then move on to treatments. And these aren't surgeries. We're not cutting anyone open. There's no anesthesia. We'll talk a little bit more about it, but these are minimally invasive procedures that we do here in our office. And the idea is that we can effectively close the veins that aren't working properly. And the main way of doing that is something called catheter ablation. And that's basically using either heat, which is thermal energy, or glue to actually seal that vein shut. We tend to prefer heat because it seems to be faster, easier for patients. But in theory, any of these options are good options. But the idea here is imagine you have a leak in your attic causing a flood in the basement. In order to fix the basement, you got to take care of the leak in the attic first. And that's what catheter ablation is. It's sealing the leak at the top of the vein. So we use a specific catheter it's tiny, it's like a spaghetti string. It's got these electrodes at the end of it. We attach it to a generator, press a button, and we heat the vein shut. It's a pretty straightforward procedure. It's a picture of me doing it here in our office. It's a tiny little IV that's going in the back of the calf to treat the calf vein. We got a catheter going through it. Here's ultrasound probe, and we're basically numb up the area around the catheter using ultrasound. We press a button, basically heat the vein shut. It takes about 15 minutes or less, so it's very, very quick. We follow up the catheter procedures with a procedure called sclerotherapy. And sclerotherapy is essentially the cleanup procedures, as I like to say. So if we've taken care of the flood, if we've taken care of rather the leak in the attic, now we got to take care of the water in the basement. And that's what sclerotherapy is. These are very minimally invasive procedures with tiny needles. We use an ultrasound to guide them into the residual veins that persist, the branches of the veins that we have heated, and all the little varicose veins and spider veins in your legs. We inject this medication into those veins, causes them to shrivel up and disappear. It's a very effective treatment. So eventually we can make a patient go from looking like this to that, which is fantastic. I would say more importantly, we could also make your legs not only look better, but feel better. So patients often notice that their legs feel lighter, they have more energy, they're able to move better, exercise is more meaningful, physical therapy is better, recovery from surgery is better. So these are all very complementary procedures that truly help quality of life. The logistics are relatively straightforward. The important thing is everything we do is done on an outpatient basis. So everything is in our office. These are very low risk procedures. We typically do it with local anesthesia only. The procedures are relatively quick, usually 15 to 30 minutes. There's a little time changing and getting prepped. So we usually tell patients anywhere from 15 minutes to an hour, depending on the type of procedure. Oftentimes, it'll take about 2 to 5 visits per leg because many patients will have multiple veins that will need to be addressed, and we'll need to do different types of treatments, as I mentioned, to actually close the veins off. I do want to address the concept of closing the vein off. I think people often ask me, well, gosh, don't I need that vein? The truth is, you don't. If the vein is faulty and it's not working, it is very possible and safe to close the vein off. And actually, 20 or 30 years ago, doctors would do something called vein stripping, where they'd actually make incisions and pull the veins out. We don't do that anymore. This is, there's safer and more effective ways to do it that are better for patients. So that's what we do now. We see all our patients back. We see patients back generally within 2 weeks of the procedures, back again at 6 weeks thereafter, and usually annual follow-ups after that. And it is covered by insurance. So that's definitely a good thing. I want to address a few frequently asked questions before we open things up to the audience. Patients often ask me, how long do I need to wear compression for? Usually after these procedures, we recommend thigh-high compression for a 2-week period to make sure the veins stay compressed. That usually ensures the best results. After that, I tell everybody, you can abandon compression completely, but I think for most patients, if you can wear them about 3 days a week or so, that's usually enough to help promote, healthy veins and get the fluid out of your legs. It doesn't have to be perfect, but some consistent use of compression is very helpful. How long does it take for my veins to look and my legs to feel better? Usually about 4 to 6 weeks. So after we do these procedures, it's very normal to have bruising. There'll be some aches and pains, nothing terrible, but I kind of joke and say it'll be a little worse before it gets better. But once it gets better, it's a lot better. And I'd say over 90% of our patients are very happy. Is there any downtime with the vein treatments? Not really. We have patients who even come in on their lunch breaks to get this done. So you can pretty much get back to your usual work, school, or leisure activities. It's not an issue. Are there any restrictions? The only major restrictions we have are really no hot tubs or pools for a 2-week period. That's just because, one, a little bit of infection risk with that, mostly theoretical, but we want to be safe. And probably more so, we don't want the heat from water to actually help open up those veins again, as the point is to close them. But after the 2 weeks, you're pretty much good. You can still exercise, you can still do all the things you need to do. You don't need a driver. This is typically done with local anesthesia. If you are very, very afraid of needles or have anxiety, we can arrange for some Valium or some other anti-anxiety medicine. In those situations, we would ask that you have a driver, but I'd say the majority of patients don't require that. Procedures don't really hurt. Little pinch and a burn. It's kind of like getting a shot in the tooth when we numb up the skin. But after that, it's not too bad. It's normal to have a little pressure, but overall, very tolerable. And again, the number of visits generally depends on the veins and how severe the condition is, but generally anywhere from 2 to 5 visits per leg. This is a little bit about our practice. Again, we're Image Guided Solutions in Missouri. I'm Dr. Devulapalli, interventional radiologist. We're located at 305 North Keene Street with Columbia Podiatry. We're the region's only outpatient vascular and interventional practice. And, I'm glad to be here, and I'm happy to help anyone with their veins. So with that being said, thank you so much for tuning in today.